Good afternoon, everyone. My name is Simiran Choudhary, and I welcome you all on behalf of Voice of Healthcare to one of our special podcast series, Immunity Talks for Protecting Public Health. This podcast series is dedicated to raise awareness and promote the critical importance of vaccination in safeguarding public health. As we dive deep into the discussion today, we aim to highlight the latest advancements, challenges, strategies in immunization and all while addressing the barriers to achieve widespread vaccine coverage. This year's theme is Immunization Protecting Our Future, which resonates deeply with our mission to ensure that every individual, regardless of age or background, understands the vital role that vaccines play in preventing the spread of infectious diseases and protecting our communities. Today, for our episode, we have our guest, Dr. Pallavi Panse, consultant OBS and gynecologist at Jupiter Hospital, Pune. Welcome to our show, Doctor.
Thank you.
Thank you so much. So, moving forward, I would just like to give a short introduction about Dr. Panse and her career. So, she is a distinguished consultant, OBS and gynecologist at Jupiter Hospital in Pune. With extensive experience in the field, she has conducted over 3,000 deliveries and performed more than 360 surgeries, including laparoscopic and hysteroscopic procedures. Dr. Panse is known for her expertise in high risk OBS and her commitment to advancing women's health through innovative practices. Her insights and contribution make her a valuable voice in our discussion on maternal health and more. Doctor, moving on to our conversation, I would like to start by can you explain the role of immunization in obstetric and gynecology and why is it crucial for both expecting mothers and women who are mothers and the child? Could you elaborate on the key vaccines that are recommended during the pregnancy?
Sure. Basically, any vaccination which is given to all females of any age group, obstetrics that once they are pregnant, and gynec is irrespective of the state of pregnancy, any vaccination is always preventive. It always prevents us from getting the disease. So, vaccination plays a very important role in preventing us from getting that disease and prevent us from the morbidity associated with the disease. Routinely in the pregnancy, presently we offer these three minimum vaccination. Many people know it commonly as कि दो टीटी के injections ले लिए. So nowadays, for TT, we have replaced it with tetanus and diphtheria. So we give it as TD injection in the first trimester, and just before within last 6 weeks of delivery, we in rather than giving only TT, that was tetanus toxoid, nowadays we give Boostrix or Tdap, which has tetanus, diphtheria, and pertussis. So which covers against pertussis diphtheria for the baby also after delivery. So, जो routine previously it was given as plain TT, it has been replaced by TD and Tdap these days. And in pregnancy, one more vaccination we give these days very to every female we recommend is against a flu. So it's a flu vaccination. So which prevents us from, of course, like H1N1,
Yeah.
but also the common flus and other strains of vaccines. So these are the three vaccines we routinely recommend to all pregnant patients.
Great. And is there any some common challenges which you encounter advising pregnant women on immunization? That obviously they have so much of questions in their mind. Okay, this can cause some kind of side effects, or is they good for? Obviously, they come to doctors because they know they are in the safe hands, but somehow they are very cautious and afraid of taking new steps in whatever changes they're coming into the life. So, how do you addresses these concerns and challenges?
Uh, we don't really have to uh, convince them much for tetanus because everybody is aware that they have to take it. But yes, there are challenges while prescribing them about flu vaccine because everybody is not aware of it. So, and I think it's fair enough on a patient's part to ask for the doubts that are there any side effects? Are they safe in pregnancy? How useful are they? What will happen if we don't take it? So, the routine answer, which is given by most of the practitioners, is any vaccination can have side effects. It completely depends on the body of any person. Okay, somebody will react in some way to any vaccine, somebody will not react to it. But we have been giving it for many years. It's been proven safe after many studies that these vaccinations are safe. And of course, if anybody, the commonest infections are airborne, like any flu can happen to anybody having a sneezing and all. So, and we don't want that to happen in pregnancy. It becomes difficult to treat if they get the disease. So once we explain them, most of 95% of them get convinced and they go ahead with the vaccination with us.
And in your experience, since you have this extensive experience of, treating so much of pregnant women and deliveries, so in your experience, what cases and how has immunization contributed to better pregnancy outcomes rather than the previous era where there was lack of knowledge, lack of vaccines, and lack of medical updates, advancements? So, and are there any specific examples or case that you have in mind that that you can showcase? Okay, pregnant women who have taken all the vaccines have this kind of results, and those who somehow missed it or they were not able to take it were the different case.
Uh, Nowadays, we don't see tetanus. I have not seen a tetanus patient in my practice. So, of course, the vaccination is the boon for us for not having tetanus. That's for sure. H1N1, I just have one case, just happened few months back in my practice that I advised her. Somehow she was a very high risk pregnancy. They were quite anxious about everything, so they didn't take flu vaccine. And practically after 10 days of prescribing my thing, she didn't go for it and she came positive H1N1. Then it
Okay.
was a task for her, but it's okay, that can happen with anyone. So I feel the vaccination should be taken. They are preventive and no major side effects in majority of the people. So they should be taken.
And following up on the case you just mentioned, that was a high risk pregnancy. So, for women
Mhm.
with high risk pregnancy, are there any special consideration or precautions when it comes to immunization?
No, no, no. They're
They're
same.
the
They're
same
same
thing.
for.
Okay. And in case of this postpartum period, so what role does immunization play in that period? And are there any specific, okay, after pregnancy, you have to take that kind of vaccine or set of vaccines which has to be taken after that?
No, there's no routine recommended vaccinations post delivery. No routine recommendations for the mother. Of course, the child vaccination is a complete thing that goes ahead with the pediatric thing, but no routine vaccination for the female. Pre pregnancy, yes. Before planning pregnancy, there are particular important things. Like before planning pregnancy, if any couple or if any female comes to me for a preconceptional counseling or a preconceptional consultation, then I do check with the history that they ever got chicken pox in their life. If they've not got chickenpox, I get their blood test done to confirm that do they have a immunity against chickenpox or not. If not, I do recommend them a vaccination against chickenpox, which are two vaccines, minimum 4 weeks apart, given just below the skin. And there is another vaccination that is against rubella.
Okay.
Uh, if the Again, there's a blood test called as rubella IgG, which can confirm that whether the female is immune to rubella infection or not. And if she is not immune, I do recommend them a vaccination against rubella because these two are the viral infections which can be prevented by vaccination. And if they happen during pregnancy, like If the rubella happens within first 3 months of pregnancy, there can be problems in the development of a baby. There can be abnormalities in the child, or there can be miscarriages, so which can be prevented by vaccination. So of course, pre-pregnancy we do have a protocol. We do check it and give the vaccination or advise the vaccination as and when required to the females.
Great. Thank you so much for explaining that to us and to all our audience, because I think most of them were not aware of that. We also have some pre-pregnancy vaccines
Yeah.
criteria of the
Yes.
test as well.
Pre-pregnancy is important.
Yeah. Thank you for explaining that. So, moving on, this was the narrow topic when we were discussing about how important is vaccination for a single mother or the expecting mother. But if we have to see on a broader aspect, so how does vaccinating mothers contribute to broader goal of protecting future generations? And can you discuss the concept of maternal antibodies and their impact on the newborn health?
Yeah, of course. As we discussed, ki nowadays instead of plain tetanus toxide, we give tetanus diphtheria pertussis, that is Tdap or Boostrix. So within the last 6 weeks of delivery, so that protects, that gives the immunity, and that protects for the child which is born within 6 weeks of delivery against pertussis and diphtheria. And of
Yeah.
course, the baby gets vaccinated once it's born as per the pediatric IAP schedule, but they do have a better effect of that.
So,
And
what?
other vaccinations
Yeah.
like a flu vaccine and all, they're for mother,
Okay.
they're for maternal health.
So, were there any complications during the COVID period? Because if somehow mothers, two cases, if mother is protected against COVID-19 through the vaccine, or the other cases, the mother has not got any jab of COVID-19. So, did that affect the health of the newborn, or it was just pretty normal?
No, it didn't affect. Actually, we have not that much studies about COVID vaccination with the newborn health. And that time it was already COVID was happening to the females. Plus, and that time we were not giving COVID vaccination to who are pregnant.
Okay.
Pregnant females, we were not giving COVID vaccines when it was pandemic. So we were not, that was not, the safety proven was not there. So we were
Yes.
not giving COVID vaccinations to those who were already pregnant.
Okay. So, as gynecologist, how do you see role in promoting immunization among women, not just during pregnancy, but across all stages of life? Because we all know how important is immunization in protecting a single person's health to a family and then to a nation, and how it protects the future of our country as well.
Yes, of course. We can speak about HPV vaccination, which is very commonly prescribed to all the females. I feel HPV vaccination should be taken by all females between the age group of 9 to 45. That's the only vaccine which is available preventing cancer, which is a very big thing. Like, it's the only vaccine which prevents against cancer. Other vaccines generally prevent against some of the disease or some of the viral infections, but HPV is claiming against a cancer prevention, so it should be taken. It has been taken since last 15 years, so the safety is also proven. If the girls less than 15 years are opting for it, only 2 doses are required. If they're more than 15, then 3 doses. But it's a good thing and we should opt for it.
Thank you so much for that. And lastly, I would ask to give or share a message to all the listeners out there on importance of maternal immunization, child immunization, and overall immunization, and the importance why it is important to spread awareness.
Because vaccines are preventive and they are generally studied after a long trials, they come in market. So their safety is proven. So if your doctor is advising you the vaccines, you should go for it. Prevention is always better than cure.
Yes, you said it right. Prevention is always better than cure. And luckily, or we not luckily, but because of all the hard work in our country, the people, the talented organization, and everything, because of the teamwork, we have all those resources that we can prevent the diseases. We have the vaccines availability. We have great healthcare industry, healthcare providers, and doctors like you. So we can, if we want to eradicate, or we can keep us safe from any kind of disease. So we should. And thank you so much for spreading that awareness with us and coming to our platform for sharing your experts and insights with us.
Thank you for the opportunity, Simran. Thank you.
Thank you.
Thank you.